So can you provide us a little bit of information about the psoriasis trial that we're currently running and how it impacts the patients that are involved in it?
We're very excited to be involved in the psoriasis study as well. We have a large community of patients with psoriasis on the Sunshine Coast, and we are an outdoor community. So people enjoy being out at the beach with their family and friends, outdoors playing sport. Psoriasis can be quite a disfiguring disorder, and it can make patients feel quite shy having the condition and also self-conscious, especially young folks.
So psoriasis is obviously a condition that affects a lot of people, and can you tell me a little bit about what exactly the signs and symptoms would be of somebody who is suffering from psoriasis?
So psoriasis is an autoimmune condition where your body recognizes part of itself as being foreign, and in this case it is the skin. So you have antibodies that you develop to the skin, and the reaction that occurs then results in thickening of the skin, flakiness of the skin, itching of the skin, redness, and a rash that develops. And it can be quite disfiguring. It can occur in the scalp, behind the ears, inside the ears, elbows, knees, trunk and back. So not just in areas that you can easily cover up as in arms and legs, but also your scalp. And patients often find that it makes them quite self-conscious of it. The itching can be quite awful at times, and if you do scratch that rash, then you can have that possibility of introducing a secondary infection to it. It's very exciting to be involved with this particular psoriasis study, because for the first time we have a formulation that is a topical application. Traditionally, applications have been subcutaneous injections or IV infusions, and now we have this new topical formulation, which makes it much easier for patients to apply. It doesn't take a lot of time or effort for them to do that, and they can carry on getting on with their lives. So it makes life much easier for them. And so, what we hope will happen for patients is that they will be able to get their psoriasis under control in a very simple, easy fashion of applying a topical gel and being able to get back out into running around outdoors at the beach with family and friends, and getting back to enjoying their quality of life.
And we've discussed this a couple of times before about how the application can sometimes be just as important as the actual drug that's coming through as well. If it's going to be a drug that they no longer have to come into the hospital and they have to have IV infusions, or they have to self-inject, which is another thing that not many people want to do. This is an exciting opportunity for people to actually be involved in a trial that is a topical application.
Yes, exactly. And I think the other thing is psoriasis can affect younger people as well. And so for many of the older participants who are coming in, that may be something for them to consider, a topical formulation rather than the traditional ones which they may have been exposed to. But because psoriasis also can run in families, it's an opportunity for us and them to participate in a clinical trial that could actually perhaps mean that future treatments for future generations may able to be as simple as a topical formulation for them.
What is your motivation to conduct this research that you're involved in with the psoriasis?
In general practice, I've worked with many patients over many years, and psoriasis is one of those conditions that make patients feel overwhelmed at times because it is an autoimmune condition. We don't have a full cure for it. We can try to control the symptoms of it. We can try to relieve the symptoms of it. Ideally though, to try and find that medication that does all of those things but also has few side effects but is also easy to use is the ideal. So this formulation, being a topical one, seems to be a wonderful transition from our subcut injections and intravenous infusions in the journey of psoriasis treatment. So to be able to offer that treatment for folks who enjoy being outside, and living on the Sunshine Coast is one of the reasons we live here, is to be able to get outside and enjoy life on the beach and outside hiking and all those kind of things, which so many patients with psoriasis are not always able to do. So being able to offer this makes me feel that it opens many doors for psoriasis patients to get back to a wonderful quality of life without that disease dictating where they go and when they go and how they live their lives.